Hi, I'm Dr. David Hill, and today we're going to be talking about tick fever in babies. So here's the good news. Infants are not very likely to get bitten by ticks because they don't tend to walk through tall grass. You have to be able to walk through tall grass. That said, babies may be crawling, they may be toddling a little bit, and you may take them outside, put them on a blanket, go for a picnic or a hike. So it's not that babies are also immune to tick bite either. Now, one of the funny things about tick bite, not everybody knows when they've been bitten by a tick. You'd think it would be obvious, but frequently a tick will bite, feed, and then fall off. That doesn't mean just because you haven't had a tick bite that you can't have a really serious tick-borne illness like Rocky Mountain spotted fever, Ehrlichia, or Lyme disease. All of those illnesses can cause fever, and we're going to brush on each of them briefly. Also, you can have tick fever as a result of having a tick that's still adherent to the body. So, if you have a baby who has a fever, and you know that you've been outside in an area where there might have been ticks, certainly do that all-over body scan and see if there is a tick. Now, Lyme disease probably scares us the most of all the tick-borne diseases, although they can all be really nasty. They can all lead to death. But Lyme disease can have the hallmark erythema migrans rash, where there's redness and it's expanding in a target shape. So there's a redness around the bite and it just keeps getting bigger and bigger. Now, we don't want to mistake that for a ringworm, but sometimes you just have to bring the baby to the doctor and say, what is this thing? Do you think it's a ringworm, or do you think it's one of those scary erythema migrans rashes that might mean Lyme disease? Certainly Lyme disease can come with fever. Now, Rocky Mountain spotted fever also obviously comes with fever, and usually with spots. By spots, we're talking about red dots on the skin that don't go away when you mash on them. That said, the spots are a pretty late symptom of Rocky Mountain spotted fever. So any baby who develops a fever after being in a tick-infested area really should be examined and seen by a doctor whether or not they have spots. A similar tick-borne disease is called ehrlichiosis. This has been more recently discovered, but it acts a lot like Rocky Mountain spotted fever, just there's no spots. In fact, some people call it Rocky Mountain spotless fever. So as a general rule, if your baby has been out around tall grasses or brush, you think there might have been some tick exposure, and now they have a fever, especially a fever that's over 104 degrees, that's going on for greater than 3 days, or that does not appear to have an explanation like cold symptoms, for example, certainly you want your baby seen. A last word on babies and fevers: if your baby is under 3 months of age and has any fever at all, that is potentially an emergency. Your baby needs to be seen right now. Talking about tick fever in infants or babies, I'm Dr. David Hill.